Hi, I'm Bailey, and my philosophy on nursing is that I think patients should have the right to make their own decisions regarding treatment, their well-being, and being treated as equal. I think that everyone needs to have the right to make whatever treatment decisions they want, whether I agree with it or not. And I'm also a firm believer in treating my patients as I would want my mom or my dad to be treated. I think sometimes nurses become numb to situations, and I don't want that to happen to me because I genuinely like to care about my patients. My first example is when people make the decision to become DNRs. We as nurses have to respect that decision, even though we or the family sometimes might not agree with it. And on the other hand of that, when a patient or a family wants to continue to be a full code, even though you know that bringing them back would just prolong any suffering and wouldn't really improve their quality of life, we still have to do our jobs and act accordingly. And then there's the situation when the patient is a DNR and they stop breathing or their heart stops, and then the family panics and tells you to resuscitate them. And that puts us in a tough situation because we know that the patient doesn't want that, but we have to respect the family's wishes. Another point is when patients refuse medications even after you've explained the reason behind them and why it's important for them to take them. And unfortunately, we have no choice but to respect that decision. Another thing I see patients refuse a lot is DVT prophylaxis. My thinking is, why add another problem to your list of why you're here? And some people just think that the little STDs are annoying when they squeeze their legs, or the Lovenox shots hurt their belly. So it's important that we respect the reason why they don't want to, but as long as we've explained the reason behind it, I think we've done our jobs. And lastly is the thing I struggle with the most, and that's when nurses don't treat people as equally as they should. Like the unquote drug seeker that come in for the quote unquote chest pain. I think it's important to treat them as I would anyone else and believe them that their pain is real and treat their pain. I have seen nurses hold these medications for patients, and I strongly do not agree with it. Or when a patient comes in with withdrawals and the nurses say, well, they did it to themselves, and they very well may have, but it is our jobs to be their healthcare providers and treat them the way they need to be treated. And we need to help these people because this is what we went to school for, this is what we did, and so I always, every day when I go into work, have the attitude of improving a person's quality of life. But that's about all I have, so thank you.